discussion in our expert groups, and also in the expert groups by other collaborators. Indeed, all the protocols that were presented, or the majority of them, has the potential to evaluate enhanced disease. I just want to explain there are 3 levels of the evaluation. First is during the preclinical phase. So there are ongoing efforts to try to establish animal models that will allow us to evaluate enhanced disease in animal models. That has been accepted as a potential way to evaluate, but it's not sufficient. In addition to that, you have to start by going through the clinical evaluation phase and evaluate it in humans. The most important part of the clinical trials to be able to document enhanced disease is to have longer-term follow-ups. And most of the trials that are being planned include 12, 15, and 2 years follow-up. And in addition, it has been clearly identified that there is the importance of post-marketing surveillance of safety as an additional element to document enhanced disease. So most of the sponsors or potential sponsors, developers, and researchers are fully aware of the importance, and the majority of them are making provisions in the protocols for the phase 2b/3 trials, for longer-term follow-up, for measures to document information from vaccinees in hospitals, etc., so that this can be ascertained. And I insist, it remains a theoretical challenge, a theoretical possibility, but is well considered by all.
Thank you, Anna Maria. I think we will stop here for today. It has been a long day for everyone. Thank you for your interest. And I don't know if one of my colleagues want to say final words. If not, we will conclude this press conference. Maybe Soumya, final words?
Yeah, maybe just as final words. I mean, we did also have some discussion on the transmission from human to animals. This may be of interest to some people, and it's clear that there are some animals like the felines, the cats and the ferrets and even tigers that can get infections. So human to animal, but very little evidence of the reverse. And also interesting data presented on the virus and how long it can survive on the fur of animals and so on. So there's very little risk from domestic animals, because there was some concern and about domestic animals becoming a source of infection. However, you know, you would have seen the reports of minks in mink farms actually getting the infection and even perhaps being able to transmit it to humans. So this is again an active area of research. As I mentioned, the animal-human interface, and it was a robust discussion because, of course, it's relevant not just for this outbreak, but also for the prevention of future pandemics. And so the whole issue of how does one not only have surveillance for these emerging viruses that can cross the barrier, but also surveillance among different species of animals to see what viruses are circulating, and importantly also to think about how markets that deal with meat and food need to be regulated. What are the minimum hygiene standards that need to be put in place? And also the illegal trade of wildlife, which can actually aggravate some of these conditions. So that whole area of research, the One Health, where the group actually has people from FAO and OIE, in addition to scientists from around the world, was also one of the areas that was discussed. So overall, I think we had, as I said, in a limited time, covered a huge array of topics and were able to get glimpses into what's going on in these different areas. But we will probably follow up with more in-depth interactions with the scientists within the working groups, and perhaps also between working groups, the interdisciplinary work that was very much encouraged and welcomed by the participants in order to take all these areas of work forward. And we're happy that WHO has been able to bring together scientists from around the world to collaborate, but also to accelerate, I think, the science. And our goal is to see that the learnings from science are as quickly as possible channeled into impact for patients and communities. That's the goal of this research. It's not an academic exercise. It's how do you take the learnings, put it into interventions, either in clinical or in public health, so that it starts, we start seeing an impact on the pandemic. And that's why WHO is so involved in this and key to try to make this happen in the best way possible. Thank you very much for all of you for having come and for those excellent questions that you had today.
Thank you for your attendance, journalists as well as our colleagues from WHO. As usual, we will be sending you the full audio file, and the transcript will be available as of tomorrow on the WHO website. So see you next time, and have a nice evening. Thank you. Bye.